Greetings, my fellow student physical therapists. This is the Patient Care Skills Address for Skill 25. You may doubt our ability to accurately complete this skill, but you are all fantastic. And I firmly believe that together we can this skill for patients that have general weakness, paralysis, or paresis. There's specific situations like weakness in one leg, non-weight bearing in one leg, or general weakness that require max assist that will require specific conditions, but we'll get to those later. Which I've already done for us is put the wheelchair parallel to your higher surface, lock the wheels, and then move the footrests out of the way or take them off. You want the patient to have their feet firmly planted on the ground. You want to make sure you have your footrest close by so it's easy to access once the patient has reached standing. When performing the skill, you can use various hand positions depending on the assist level of the patient. So I can either put my right hand under his buttock to support and help him rise to standing. I can put it on the posterior lateral aspect of his hip, and that would control lateral pelvic shift, as well as if something happened, I can move my hand quickly under to help support him as well. And then anterior lateral, you can actually provide some resistance, which will teach them to move their pelvis. For basic support, you want one leg forward and one leg backward to provide stability, as well as not get feet tangled when you're moving throughout the skill. So what I'm going to do is I'm going to put my right leg next to his left foot laterally. I'm going to stagger it with this foot back. My left hand will go on his shoulder. My right hand will go on his pelvis. Depending on what assist level we need, it changes where the hand is. Okay, Robbie, so what we're going to have you do is you are going to push forward on these and lean forward. I'm going to give you the command 3, 2, 1, up, and on up, we're going to stand. Okay? The two joints that you always want to be protecting are the hip and the knee. So you want to prevent lateral shift when performing this skill. You ready? Okay. 3, 2, 1, up. You want to move the footstool in front of the patient next to the treatment table. They are going to take their right leg and bring it up on the footstool, raising their pelvis, and then pivoting once it's higher than the treatment surface. His right hand is going to be on the treatment surface for stability. As the PT, you're going to take your right knee to their left knee to maintain support and stability for them, as well as your right hand will be helping their hip, their left hip, and your left hand will be on their shoulder, also for stability. So Robbie, are you ready? Okay. Okay. Always maintain contact throughout the whole transfer until they are in a safe and comfortable position on the treatment table. For general weakness requiring max assist, we will not be using the footstep and refer to Jen's skill number 23. In a patient with one non-weight bearing limb, that limb will not touch the ground the whole time. They will stand and then use an assistive device to raise themselves up onto the footstool and set themselves down. In young patients with strength and balance, they can perform this task without any assistance, but as you get into higher assistance levels like moderate assist, the physical therapist will provide assistance throughout the process. See future assistive device skills in this course. If you have a patient with one weak lower extremity, you want to have the weak lower extremity on the outside where your support and guarding is. So in someone with that weakness, you really want to emphasize supporting that knee and then helping that hip throughout the entire process. For transfer precautions, skill number 9, and then during this transfer, depending on the assist level, you are going to want your patient to wear a gait belt.